Hello, welcome. I'm Dr. Tony Malioco, the Cancer Informant. Welcome to a new episode. Now, today's episode is entitled Surviving Cancer. How can I improve my odds? Being faced with a diagnosis of cancer is a troubling experience. It causes a lot of concern in the patient and their loved ones. However, there are many steps that you can take to improve your odds of beating this disease. The first thing is to really learn about your condition and ensure you have an accurate diagnosis. You might be surprised to know that cancer diagnoses are frequently inaccurate. This is because the diagnosis of cancer is challenging and can be very complex. There are literally hundreds of different types of cancer affecting every single part of the body. Now, this is why a team of people are actually involved in the diagnostic process. It may involve a radiologist who is looking at x-rays, a surgeon who does a biopsy, and then your friendly neighborhood pathologist. Now, one of the most important people in this team is the pathologist. The role of the pathologist is to examine the tissues that have been removed, typically down a microscope. A pathologist will carefully look at the tissues and determine if they are benign or malignant. If the tissues are malignant, a pathologist will make a classification and determine what sort of cancer this might be. In addition, a pathologist has to decide how large is the cancer, is it involving a margin, and has it spread to adjacent organs or lymph nodes. This is a lot of work that a pathologist needs to do, and there are many opportunities for error. In addition, a pathologist has to arrange additional testing. Additional testing is important, particularly in cancer, to determine what therapies might be useful for treating a cancer. This type of testing is often called companion biomarker evaluation. For example, if a patient has a diagnosis of breast cancer, it is actually imperative that a pathologist remembers to order several tests. These include estrogen receptor, progesterone receptor, HER2, Ki67, and many more. This information is of high importance to determine what therapies are most likely to be effective in this particular patient. There are also many new innovative tests that pathologists may not think to order. These include genetics to determine if a patient has a predisposition to cancer, and liquid biopsy that can help with the staging of the cancer to determine if additional therapy is necessary and if the therapy should be changed. The reason I say if the therapy should be changed is because cancers can actually evolve and change over time. As a cancer is treated with an anti-cancer agent, it occasionally will develop resistance where it changes itself and develops a new appearance. These modified cancers or evolved cancers might now be treatable with a different therapeutic approach. So we can see that the science and the specialty of pathology is extremely important when evaluating a cancer patient's tissues. So the first thing I would say is to ensure that your diagnosis is actually correct. A patient can actually ask for a second opinion on their pathology. This is not very unusual. A patient's tissue is stored for up to 10 years. If you have a diagnosis of cancer even from a few years ago, there's a great likelihood that tissue and slides will still be available. These slides can be easily accessed and sent to another specialist pathologist that can review them and determine if the original diagnosis was correct. It's also important to remember that new tests are being developed on a very frequent basis, almost annually or even more often. So if a diagnosis was made several years ago, it might be worth revisiting that diagnosis to determine if additional testing might help uncover underlying molecular alterations or protein expressions that can be used to select new effective therapies. So this second opinion pathology is extremely important, as up to 30% of the time, the original pathology diagnosis might be incomplete or inaccurate. Obviously, it's important to have a correct and complete diagnosis before planning a course of treatment. Now, the other thing a cancer patient can think about is what is the cancer center they're at? Do they have access to clinical trials? Clinical trials are of particular value to cancer patients and can be utilized at all stages of the disease. Some people think that clinical trials are very experimental. In fact, they're not. Typically, in a clinical trial, there are two arms. One arm is standard therapy. The other arm is standard therapy plus an innovative agent. The innovative agent actually has to go through a lot of examination and qualification before it's allowed to be used in a human trial. Therefore, these innovative agents are often known to be highly effective and safe. One should feel quite confident going on a clinical trial that you will receive the best possible care and access to innovative agents that have high promise for your disease. Consequently, I always encourage patients to look at the clinical trials options that may be available to them. Another thing that a patient should be aware of is that not all cancer centers are created the same way. Basically, at the top of the pyramid are what we call NCI or NCCN designated cancer centers. These are the elite cancer centers that have very sophisticated teams of specialists that work together to arrive at optimal treatment planning. These are also the centers that undertake very innovative clinical trials and have extensive research programs. If an NCCN or NCI designated cancer center is available, I strongly encourage patients to consult with physicians at these centers, as they will have access to the latest diagnostic treatments, therapies, and clinical trials. It's always wise to also learn more about your oncologist. Are they a specialist in the particular cancer you have? Some cancers are quite rare, for example, certain types of sarcoma or different types of leukemias. It's important that the oncologist that is treating your cancer is actually experienced in the type of cancer you have and are up to date. So they will be in the best position to help take care of your particular cancer. Also, it's known that multidisciplinary teams and tumor boards can make a huge difference. Treating cancer is now a team effort because the therapy may include surgery, it may include certain types of chemotherapy, targeted therapies, endocrine therapies, and immunotherapy. In addition, there are many different kinds of radiotherapy that can also be used. And in many patients, a combination of all of these treatments are necessary to get the best and optimal response. Therefore, centers that have experts from all of these disciplines can provide the best multidisciplinary and integrated care. Consequently, you may want to evaluate your options as to whether other modalities of treatment might be suitable for your particular cancer. Also, there are some sophisticated tests that are newly available on the market, for example, extensive genetic analysis and liquid biopsy. Not all centers have access to these technologies. It may be useful to determine if your center actually has these technologies and if your oncologist is familiar with their use. The utilization of these novel technologies can open up opportunities for novel treatments or entry onto new clinical trials. The other thing that a patient should remember is that cancer is often a chronic condition. They really need to think about their overall wellness, including their mental wellness and overall physical wellness. Coexisting conditions such as diabetes, hypertension, kidney failure can really exacerbate the development and progression of cancer. So it's important that a patient really takes their general health into consideration and try to improve that. This will also give them a better chance at combating cancer. In addition, if a patient is interested in getting onto a clinical trial, usually clinical trials are only open to patients with what's called high functional status. This means that a patient should be well enough to take care of themselves and be able to be mobile and in good condition to actually be considered for enrollment onto a clinical trial. So it's important that the general health and wellness be maintained. There are other factors as well. Adequate nutrition, avoiding toxins such as smoking and alcohol can also make an impact on response to therapy. Diabetes has a strong impact on cancer and that may accelerate growth and increase risk of developing cancer. Likewise, smoking and continuing to smoke can definitely interfere with the efficacy of therapy. And it's strongly encouraged that patients stop smoking when they develop cancer and are on treatment courses. So this concludes the main discussion of how can you combat cancer. In summary, cancer patients that do the best have support. They take knowledge of their cancer. They seek second opinions to ensure that their cancer is accurately diagnosed. And they consult with experts. Seeking help from a multidisciplinary team can make a huge difference, as many different modalities can be utilized to treat cancer, and the best outcomes are often achieved when using multiple types of therapy. Finally, getting onto a clinical trial can make a dramatic difference. I strongly encourage patients to consider entry onto clinical trials and search for trials that may be suitable for them. Thank you very much for listening to today's episode. I encourage you to visit our podcast and YouTube channel to listen to other episodes. Please also visit our website to leave comments and questions that I can talk about in future editions. I hope you have a wonderful day. Take care. Bye-bye.